pandemic unfolds, experts are trying to figure out why people who are Black, Asian or minority ethnic seem to be particularly affected by coronavirus. At times, a third of those who are critically ill with COVID-19 in the UK were from these groups. Researchers are looking at all possible explanations, from the jobs people are doing to their genetics and their lifestyle. John Ironmonger reports.
Coronavirus doesn't discriminate, or so ministers have been fond of saying, but some people see differently, as data suggests ethnic minorities may have more to fear from this epidemic and more reason to pull together. Food drops like these in Kempston can be an enormous help when you're too afraid to leave the home, and Charon's social education charity has diverted its attention to helping the BAME community.
They are getting leaflets, a lot of social media coverage, but they are not getting information they need in their own language, so they're not able to make informed decision about their health and well-being. So we are getting a lot of queries and we're trying to help them. You know, we got a number of people who can speak different languages, so we're trying our best to give them information.
Findings of a recent study by 3 leading clinicians suggest that while BAME people make up around 17% of the UK population, they account for 34% of critically ill COVID-19 patients. Similarly, while around 21% of NHS staff are BAME, they account for 63% of COVID-19 deaths in the same workforce. Downing Street has commissioned an investigation into the impact of coronavirus on ethnic minorities, but some NHS workers feel it's not enough.
There is a lot more that the government can do, not only for BAME communities, but everyone, pushing into more research that can be found to, you know, try and tackle this disease. We've seen what it can do and the effects that it's having on everyone. So the government really does need to push into research, especially into BAME communities.
This is probably one of the hardest videos that I'll ever do.
COVID-19 has sent shockwaves through England's close-knit Muslim community. Atiq's cousin Ali from Peterborough was just 30 when he died.
For a young man who's so healthy to die so quickly, it's just a big shock to the whole family. Or maybe it's the foods that we eat, or maybe it's the interaction that we have with our families. But I've got no idea why it's in the Asian community, why a lot of people are dying from it.
Amid the confusion, it's all people can do to keep going. This evening and every day, the Guru Ravidass Sabha in Bedford is preparing hundreds of free hot meals for frontline workers and care packages welcomed by these international students.
They help us a lot, like they are giving us food, because as everyone knows, universities are closed, we are not going to university, we are having online classes.
Coronavirus presents an unexplained threat to our region's ethnic minorities, but community spirit is a hard thing to shake. John Ironmonger, BBC Look East.
Well, let's bring in Professor Gurch, who's the Director of the Institute for Health Research at the University of Bedfordshire, among other things. Professor Randhawa, a lot of people are scared, they are confused by this discrepancy. What do you put it down to? Is it because they do high-risk jobs, like working in hospitals, and they live in places where the virus has taken hold?
Well, I think that all the evidence shows you that all pandemics throughout the decades, the centuries, have always tended to then impact in terms of how social inequalities tend to occur in society. So if we look at things like housing, frontline jobs, underlying health conditions, all of these are high risk factors for infectious diseases. And the uncomfortable truth we have in the UK is that BAME communities are more affected by overcrowding at home, by undertaking more frontline jobs. So if you think about coronavirus, there's disproportionately more minority ethnic workers in retail sector, supermarkets, delivery jobs, health care, home care residents, carers. So they're always going to be at more risk. And therefore, what the government needs to do and all employers needs to do is to have really clear risk assessments for all of their staff and ensure that all staff are properly protected and all the public are properly protected.
Professor Randhawa, are you surprised that that isn't happening to the level that you would expect? Because we are weeks, well, months really into this pandemic now. And if you say pandemics follow a pattern and they always go this way with these communities, why isn't it happening?
Well, it's a bit like I teach our public health master's students. It's You know, when you do public health protection, yes, you absolutely have to get the NHS capacity right, which I think the government have done. But at the same time, you need to get the public protection right. And that's all about getting the testing capacity right. But most importantly, it's about engaging with the public and making sure they're protected. So if you think about people who've got 0-hour contracts, we should have straight away put in place measures so that those people didn't need to go to work to put food on the table, but reassured them that they'd still receive enough income by some other means to have food on the table. But unfortunately, there aren't a lot of people who are at most risk. They're having to go to work. They are putting themselves at risk. They don't have the PPE, they don't have the face masks, and they don't have the gloves, and therefore they're the people who are now exposed to the coronavirus.
Professor Gurch, Randhawa, I'm afraid we must leave it there, but many thanks for talking to us on the programme this evening. The government has promised to examine its response as part of this investigation. We'll wait to see what happens with that. It is 6:45, still to come on Look East.